Hello, I'm Senator Kirkpatrick, State Senator for District 32, and a doctor. Today, I want to speak with you about the COVID-19 virus because a number of you have reached out to me with questions. Confusion is understandable because the guidelines have changed a number of times. That is because the virus has changed. Viruses mutate to stay alive, which is the reason variants occur. Right now, we're dealing with the Delta variant. This is different than the Alpha variant, which I had back in March of 2020. At that time, the high-risk groups were elderly and those with comorbidities. The Delta variant is different, is more transmissible, and can affect adults, kids, and everyone in between. We're currently in a fourth spike, and our hospitals are filling up, and intensive care units are nearing capacity. This limits their ability to take care of people with heart attacks, trauma, and other serious medical problems. Some hospitals are setting up surge facilities or even temporary morgues. The children's hospitals are seeing increases in COVID admissions and in ER visits. Our healthcare workers are burned out, exhausted, and living a nightmare. What can you do to help? There are a number of things that we do not have to be told to do by the government or employers, but can choose to do on our own. Basic infection control techniques are important to helping slow the spread of the virus. This includes washing your hands and not going to school or work when you're sick. Also, remember that outside is safer than inside, so stay out of crowds and enclosed areas. Masks, when worn properly, can be effective. They help with the spread of droplets caused when coughing, sneezing, singing, and even talking. They're especially useful in enclosed spaces where you cannot distance. If you need testing, the ER is not the best place to go for that. There are many commercial and public health sites available. As for vaccines, the data shows that the Delta variant is covered by our current vaccines. The vaccine does not protect you 100%, but most people who are getting hospitalized with the Delta variant have not been vaccinated. I would recommend that you talk to your doctor about your risk profile if you're not sure. I had the COVID-19 virus back in 2020 and have been in an antibody study since then. I'm fortunate to have fully recovered with no long-term effects, but you don't want to get this virus because not everyone is so lucky. My antibodies lasted all the way out to 9 months, and after I got my first vaccine, they went back up to the same level as they were right after the virus. After my second dose, they doubled, and now I get blood drawn every few months to review the status of my antibodies as part of the study. I do not have my most recent results, but this kind of research may lead to other recommendations, like a booster shot for some groups. Again, if you're not sure about the vaccine, please talk to your doctor. There's still a lot we do not know about the virus, and it will certainly change again. But it is not forever, and our thoughtful decisions as individuals can help. If you want to track the number of cases in Georgia, you can find them on the Georgia Department of Public Health website. Finally, and of course, thank you to our healthcare heroes who put themselves at risk for others. Stay safe.